All right. Well, welcome to Effectively Addressing Youth Risk. We'll be here today for about 30 minutes. And I'm going to introduce Dr. Jennifer Salerno. She is a pediatric nurse practitioner and translational researcher within the field of adolescent risk and prevention. She has dedicated her career to training professionals and developing technology-based scalable interventions that reduce gaps in care and variability in provider practice. So we are excited for Jennifer to lead us through this webinar today. And before she gets started, I just want to cover a couple housekeeping things. Please view the presentation in full screen mode. This will allow fonts and images to be able to see it fully. They sometimes will appear small if it's not in the full screen mode. Throughout the webinar, we will be using polls and chat for activities, so make sure you have that available to you. And then also, if you have any questions throughout the webinar or need anything, go ahead and chat me on my name. It says Leah Alfonson, but it says coordinator. So you can go ahead and just chat me individually and I can send you what you need. And then also at the end of the webinar, we'll allow time for questions, but there is a Q&A box at the bottom that you can put questions into, and I'll be monitoring that throughout the webinar. And I believe that's all I have. So Jennifer, I'm going to pass it off to you.
Perfect. Thank you so much. Hello, everyone. I want to start off our time together with a poll. We know it's important to engage youth in their health. That's why you're here, obviously. And we also can acknowledge that there's a lot of barriers that get in the way of providing what we would think of as quality or effective care. So let's start with a self-reflection poll, and Leah will launch the poll for us. And if you can answer the question, how effective do you feel in identifying and addressing health risks in your youth, whether it's patients, students, clients? And then Leah, I'll let you kind of look at that.
Do you see the poll button at the bottom?
Yes, is it not coming up for you?
It's not showing up for me.
Okay.
Oh, there. Okay.
All right. So you can answer that on a scale of 1 not being at all effective, which we all have days like that, or 10 being extremely effective. Where do you feel like you are? So I'm gonna share the results. You can take a look here where we kind of fell as a group, which is pretty common. We kind of clump into the middle, and then there's sort of that bell curve. So wherever you place your number, think about that. And what I'm going to ask you is, what would it take for you to move 2 points higher? So if you're one of the people that said you were a 4, what would it take to get you to a 6? If you can put that into the chat, that would be great. What would it take for you to move 2 points higher? Time and money. Those are the 2 biggest things, right? More trained personnel, more integration. These are all really common barriers and really good things to think about as we're going through some of these things. More experience. Hopefully after today, you'll feel a little more comfortable with some different tools that you can use. So thank you for participating in the chat and also in the poll itself. Great. So what we're going to do is really dig into the weeds in this webinar, and I'm going to provide you with some really tangible examples and strategies that you can walk away with and start using this afternoon or tomorrow or later in the week or in the following weeks. When we're thinking about delivering high quality risk prevention, no matter what your setting is, a lot of us have questions like, where the heck do I even start with all this? How do I know that the tool I'm using is really what's going to be most beneficial for the youth that I'm working with. And then if you have a tool, or once you have a tool identified, then what do you do with that information? Like, how do I put that into practice? How can I use potentially technology to help identify risks and then address those? And then how am I going to talk about it? Those are usually really common struggles that we all have. And for a lot of organizations, the screening tool is kind of the first step, or sometimes the only step that we think about. But with any good instrument, a youth-specific screening really should have a multitude of criteria or boxes that you're checking of whether this is the most effective tool. So I wanted to share some of those standardized comprehensive risk screening tools that are evidence-based and really the gold standards in their delivery methods. So as you know, there's different types of tools and different delivery methods related to those tools. So you could be using interview, yes and no questions. You can be using paper-based tools, and you can be using technology. The delivery is a really important piece of the screening process. Thinking about for yourself and your organization, who is it that asks the questions? So is that you all the time? Is it an interdisciplinary team? Have they been trained? Some of those challenges came up in the chat when I was asking what would it take for you to get 2 points higher? How are those questions asked? Is the screening in person? Are you still using some type of telehealth or some type of technology to connect with youth? These are all things to think about when you're choosing a tool that is going to be right for you in your practice. So we know technology helps us connect with the youth that we're serving. Now, the youth that are 9 to 24, we could be serving that whole range of preteen all the way to late teen. They've literally grown up with the technology. They're super comfortable with it. That's how they communicate with their friends and their peers. So what I'm going to do in this webinar is share some information on the RAPS technology-based tool so you can get an idea of how we're trying to connect with youth in similar ways. So technology really removes that variability. So if we step back and think about, okay, why are we using technology? What can it do for us? What it does is really ensures that every youth gets asked the same questions in the same way every time, based on your protocol, your workflows. Technology removes those things like body language, your tone of voice. All of those types of things impact whether or not a youth is fully honest when they're responding and sharing with you. And then additionally, how the questions appear to youth within the technology can really make a difference in them feeling comfortable. So RAPS uses technology that embeds a concept called digital empathy. If you haven't heard of that concept yet, it's really the use of colors, of fonts, images that help to engage youth and really encourage them to feel more comfortable answering those sensitive questions in particular. So I'm going to share some information on the RAPS technology-based tools so that you have a better understanding of what that looks and feels like, because you may or may not have experienced digital empathy or different ways that questions can be asked. So just a little background, if you don't know anything about RAPS, with just 21 questions, it's completed in about 5 minutes and is the only youth-specific short format screening available that has been both scientifically validated as a time-efficient and effective comprehensive screening tool and as a youth depression screening tool. And RAPS screens for all of the risks identified by the CDC to contribute most to morbidity and mortality in youth. And you can see those categories listed there in the bullets. And because brain development and risk factors really change dramatically between that adolescence 9 to 24 time period, the RAPS system includes 3 assessments that are tailored by age. So all 3 of those assessments are those 21 questions. And then in addition, we offer what we call the RAPS Public Health, which was developed in partnership with the American Public Health Association and includes 11 additional questions that assess social determinants of health affecting health, obviously well-being and graduation rates. So it really kind of pulls in that health, well-being, and academics as important pieces to consider, particularly if you're looking at social determinants of health. And then we have a shortened version that includes just 9 questions with only the mental health, substance use, and protective factor questions included for those different settings, particularly schools that are focused in on very specific risks and not necessarily the comprehensive view. So this is the look and feel for youth when they complete the RAPS. It probably looks nothing like what you would expect if you've not seen a tool like this in the past. If you were thinking of technology-based screening, you're probably thinking about a form, maybe in a technology system like an electronic health record, or maybe SurveyMonkey or Qualtrics surveys that you might have completed. So using that concept of digital empathy and youth focus group feedback, we incorporated those design elements. Like I was sharing earlier, they just see one question at a time, helps them focus in on the text of that question. So you get less responses that are incorrect for youth. You see, or they see, an image of teens related to the content of the questions to help engage them more. There's a speaker button that appears with each question, so it allows them to listen to the text on the page. And then in addition to the screening, the RAPS provides some brief interventions, because one of the challenges can be that when you know you've identified risk, what do you do with that information? So these were developed using a motivational interviewing framework, which we're going to get to in the next minute or so, and includes ideas for either getting help or being safer in a behavior or changing a behavior. Those are the bullets that you'll see in those interventions. And then an affirmation or a self-efficacy statement, which will be a statement at the end of the message. And then the resources you see here are also included that are government or national organization websites that are specifically focused on youth and young adults. Then we also include hotline and text options when those are available. So it's meant to be this brief intervention designed to reduce the burden on you by providing that evidence-based health information and resources, either as a standalone intervention, if you're sending out surveys to large groups of youth and then just following up on specific questions, and or you can use them as a jumping off point for your discussions. So you always feel like you have some level of support for a conversation. As part of the professional interface, you'll see a report for each of the surveys that are completed. With just a click. They can be reviewed online, they can be printed and reviewed prior to actually talking with that youth. You'll see visible, at a glance flagging for those high to moderate risk questions that were identified by youth. You'll have tallies for total risk, mental health scores, substance use scores, and then you can easily access those health messages or that brief intervention that's associated with each question. So you can use it to review the information with youth. You know that they read through that, to continue the conversation, to help inform maybe where you want to take the conversation next, and to provide those resources, or maybe you have some additional resources within your own agency. And those can be clicked on as a pop-up when that information button is clicked. So in addition to the screening tool, we spent the first half of the webinar talking about that. An evidence-based approach to then discussing those risks that were identified can make a huge difference in feeling effective and in your actual effectiveness in guiding youth towards those positive changes. So why focus in on motivational interviewing? There's obviously a lot of different strategies you could use. You may combine strategies you're already using with motivational interviewing. What I love about motivational interviewing is that it takes all the pressure off of you. So as professionals, we feel like we have to have all the answers. We do a lot of the talking, we do a lot of the advising, but developmentally, if you think about where youth are, they're in a stage of wanting more control and respect. So our standard approach doesn't often work with them, and that's really where motivational interviewing comes in. So before we jump into the strategies, I want to get an idea of your experience. So if you could launch the poll. Great. Yay, it's working. If you can let us know with a poll, your experience with motivational interviewing is from, I really don't know anything about it, which I'm glad you're here, to all the way to I try to use it routinely, which I'm very glad all of us are here and can share some of our experiences as we go through the second half of the webinar. So if you haven't yet, let us know kind of where you're at. And then Leah shared the results. It looks like we have about 25%, 26% or so. Like I've heard of it, or I don't know anything about it. So welcome. Welcome to kind of learning more about the strategies. And then our other 75% or so have attended a training or two or try to use it routinely. So thank you for sharing. What I found with motivational interviewing to be really, really helpful is that it's kind of like a skill like math. So the more you use it, the easier it feels, the more it becomes just automatic. And then the more that you can add on more advanced skills. So what we're going to talk about today is kind of those foundational skills. We'll do a little bit of practice. And if you responded kind of in that group that you use MI routinely, I'm counting on you to provide some good examples for us when we use chat to do some of the activities. So motivational interviewing, kind of at the basic level, is really just supportive communication strategies. You can use them with everyone in your life. And it actually is helpful if you're starting to learn some of the strategies or want to use it more often to incorporate it into communication that you have maybe with colleagues, with your partner or spouse, with friends. It's not just for youth or youth that you work with. It really was developed for use in substance abusing adults. And then there's two components that I'm going to spend a little bit of time on today, the spirit and strategies. Spirit and strategies fit really well into trauma-informed care. So if you're working under that framework as part of your practice, it kind of goes along those same ideas of building trusting relationships, offering choices and collaboration, and empowering youth to make safer decisions. So it falls into that same framework. So if we think about the spirit, that's really establishing that foundation for communication. So using empathy and using a strategy called ask permission. And then those foundational strategies is what we'll be walking through today are some of the basic building blocks of using motivational interviewing as a full communication. And those are open-ended questions, affirmations, and reflections. So really motivational interviewing is based on building relationships, kind of that spirit, and using strategies to both build that relationship and to elicit more information and guide youth towards making safer decisions or getting the help that they need. So what I'm going to do is review a few of the basic strategies of motivational interviewing to set that framework for working with youth. These are very simple strategies, and the key is using them intentionally. So I'm going to start with open-ended questions. These are questions that are not easily answered with a yes or no. It shouldn't be anything new to you. They are really the backbone of information gathering when you're asking a question. So you want to use open-ended questions. They put youth in the role of expert and shifts that work, like I was mentioning, from you onto them. So open-ended questions typically start with words that you see here: who, what, when, where, how, and why, versus closed-ended questions that typically start with like are you feeling sad? Do you use condoms? Can you find time to exercise? Those can all be answered just with yes or no, or you might get a shoulder shrug. And then we feel stuck in that. And then we continue to ask questions, and then youth continue to kind of back away from us. So using more open-ended questions, and then we'll get to kind of fully open or key questions, can really help you not be stuck, not feel stuck. And then as you'll see across the top, the why, you want to just be careful of using why. And even if the thing that you take away today is to be more conscious of how many closed-ended questions you're asking, and if you're using why, that's a key start to kind of building that foundation or building that spirit. So think about how much you're using why, because it's just human nature. When you're asked why, you feel defensive. So we want to try to stay away from starting a question with why. And if you look at the check marks under fully open questions here, you can put a starter like help me understand in front of it that can help take off that reaction to why. So if you say something like, help me understand why you've decided to stop taking your medications, instead of why aren't you taking your medications? Or help me understand why you're not using condoms. What I found really helpful to think about and easy to flop why is with a what. So if you are using why a lot, think to yourself, how can I change that to start with a what? So using those same examples, you would think about saying something like, what gets in the way of taking your medication? Or what gets in the way of using condoms? That removes kind of that judgment piece with the why. So those are some examples. So I want you to experience the difference in how a question's asked and what that feels like. So we're just going to spend a few seconds on this part. In the chat, answer the following question for me. How was your day? So it's a question we ask a lot. We probably ask youth a lot, like how was school? How was practice? How are things going? So when we're asked, how was your day? Or even if we ask youth, what kind of happens? So I see a lot of busy, great, long, it was fine, it was good, okay. So those are typical answers. There's not a lot to go from with that if we were gonna continue the conversation. So instead of that, what if I asked you, tell me about your day? And I saw someone in the chat had that already. So you're ahead of me, Randy. That's awesome. So tell me about your day. What would you share if I said, tell me about your day? So now I see some things like full of interruptions I didn't want. I see like, whoa, where to start? And then like, well, and start sharing. Typically, when you start a question with tell me about, you'll have to be comfortable with a little bit of silence, because what that takes is some thought. So I didn't automatically answer like you may have when it was, how was your day? So tell me about causes you to step back and think, what do I want to share based on what you just asked? So try to give you some seconds of silence to think through that before you jump in. Sometimes we're not comfortable with silence, so we want to make sure that that's part of using some of these strategies. So if we come back to the fully open questions, what you can see here is tell me about is part of that list. Because as that showed you, sometimes open-ended questions can elicit that 1 or 2 word response from teens. So we want to ask more fully open questions as much as possible to elicit some of that information, especially those youth that aren't ready to talk, they're not as forthcoming maybe as others. We just want to be careful not to start with the same starter every time. So you're not saying, tell me about, tell me about, tell me about, because then they're going to start stepping back like, maybe this is something that you're trying to trick me on. It doesn't feel like an authentic conversation. So you want to think about what are some of these fully open-ended question starters that you feel comfortable with that you can start using when you're interacting with youth, particularly ones that you're having a hard time kind of eliciting information from. Maybe that's a strategy that you take away. Some of these, you have them like on your desk or computer or wherever you're working, just to help you remember. Like, what do you think about? You can put anything in there. If you're talking about risk, what do you think about wearing a helmet? What do you think about not texting and driving? Tell me about your experiences. How do you decide when to use a condom and when not to? I use that one a lot because a lot of youth will say, well, I use a condom sometimes. So it helps me understand before I jump in to provide some information. And then those key questions, I love these questions because it helps youth to think about what will it take? What do they need? It's really that moving from information gathering to guiding towards planning for change, thinking about change in the future, intention, all of those things that we know affect behavior change. So you can see some examples here, even a summary, like given what you told me, what do you think you'll do next? Where do you want to go from here? So if you feel stuck, some of these are really helpful to kind of move you to the next place, especially with resistance. Well, what if you tried quitting vaping? What if you tried talking to your partner? What would that look like? What would it take for you to take your medication every day, for you to be safer when you're having sex? Some of those key questions help you move past resistance. So this is what is a deliberate use of an open-ended question. So kind of copy some of those down, try some of them out, especially if you're getting stuck. I see having fidget devices, definitely, so students can keep occupied while answering questions. Really helpful suggestion. So affirmations, these are also an important part of engaging teens, building trust. Youth that are told, or if they feel they're not good enough, or are more likely to use substances, report depression, report anxiety, have sex at an early age, all the things that, you know, automatically come to your mind when you're talking about teens and development. And we know that youth live up or down to our expectations. So we want to give them some affirmations. They really help to foster self-esteem and self-worth, which then in turn helps empower teens to take care of and value themselves. So affirmation statements start with you, not I. They're genuine and specific, so they're not compliments. And they typically have starters like what you see here. So you have, you are, you feel, you believe. So if we were sitting together and we were chatting and I was hearing about all the work that you're doing and all the youth that you're working with, and I said to you, I think you're a dedicated and caring professional. That feels good simply for me to say that. But what if I started with a you statement instead, sorry. And I said, you are a dedicated and caring professional. How does that feel different than me saying, I think you are a dedicated, and you are? It really, taking the I out, makes it about the youth or the person that you're talking with. So they don't depend on you. Like when they see you, oh, you think that I'm this, it's really inherent in them. So that's just a little tweak of a word that can help a strength feel more embedded in that person versus dependent on who's saying it. So some examples for each of these starters, if you're thinking about highlighting strengths that would support a positive behavior, you may say something like, you have a plan for quitting vaping. You're committed to exercising 3 times a week. You feel in control of your body, or you believe in taking care of yourself and your partner. All of those are strengths that would help support safer decision-making, whether that's in the future, whether they're doing it now. And then those positive behavior changes, like taking their medications as prescribed, using condoms, quitting substances, maybe doing some things when they're feeling depressed, like journaling, that would help them feel better. Those are all affirmations that will help them feel more empowered to then follow through with a plan. So if we try creating an affirmation with you starters, look at the statement here, and then in chat, try some affirmations that you might give if you heard the statement. I've tried using condoms, that just never works out. Automatically, we want to jump in and solve the problem, but how can we start with an affirmation? That you have, you are, you feel, you believe. You have the power to work through that. You believe that they're not effective, or you believe in taking care of yourself. You're willing to try things. You're concerned about your health. You believe condoms can reduce risk. Think about how a youth might respond when you give that affirmation. You believe condoms can reduce risk. Now you have them talking about condoms reducing risk and why it's important for them to use them without you saying that, without you jumping in. So affirmations can help you get to the same place, but now you're hearing words that you would have said, hopefully coming out of the mouths of the youth that you're working with. You have the power to make the changes you believe in. Then they'll start talking about that. you're ready to find new ways to use condoms. All of those things help them start thinking down that path of being safer without you starting out like that. Obviously, you're going to get there. So hopefully that gives you an idea. Those are great examples. Here are some other ones. You've used condoms even when it was hard. You're trying to use condoms because we're now looking at I've tried and not focusing in on the it never works out piece. You feel in control of your health when you use condoms. You believe in keeping your partner safe. And then the last piece, reflective listening. This one's a bit more difficult to master, but I want to bring it in as for some things to think about. It's one of the most effective for communicating with youth. The biggest piece of reflections is really maintaining that truly judgment-free zone. So you have to think about your tone of voice and how things are coming across when you're reflecting back or making a statement about what you heard, because that's really the key to reflections. Instead of asking questions, you're going to reflect back what you're hearing. And then you're going to add on an emphasis, maybe an additional meaning or a continuation of thought. And it feels really counterintuitive because we were trained, at least being a nurse practitioner, kind of on the physical health side, we're trained to ask a lot of questions, kind of dig into the history. But what I've learned and now seen firsthand is that using statements, even though it feels counterintuitive in the beginning, really gets you the answers that you're looking for and more. Sometimes it's like, oh, I have a lot of other visits on my schedule. Now I have a team like talking, which is great. And sometimes we get there a lot faster. So try it out. What it is, reflections are really helping you build relationships like that spirit and trust at the same time that you're gathering and learning more from youth. So we're running just a couple minutes behind. I need about 3 more minutes if you want to finish up here, kind of thinking about and hearing a little more about reflections. The key, like I mentioned, is that neutral tone and no inflection on the end that would make it a question. So if you had a youth that said to you, I've tried using condoms, just never works out, similar to what we just practiced with affirmations, you may start out with a reflection. You might say something like, you used condoms in the past, instead of with an inflection like, you used condoms in the past. We want to make sure it's a statement. We might say something like, you're having sex and not always using protection. And then you'll hear more about, what's getting in the way. So each reflection might give you a different response. And that's about using them deliberately. As you get more comfortable and learn more, then you'll kind of figure out where you want to start. A different reflection might be, you'd like to be safer when having sex. So now if you said that, they'll talk more about their motivations, like what do they want? Do they want to be safer? And what does that mean? Or you might reflect feeling. It's scary to think about getting an STI. And then that might be a motivation. If you get a reflection wrong, don't feel worried about that because youth will usually correct you. So when they correct you, then you can reflect back what you're hearing. So it can be really easy. So this was a lot of information in a really short amount of time. Like I've been saying along, please take a minute after the webinar to write down at least one strategy for positive change in working with youth. So what will it take for you to move from your first number that you provided at the beginning of the webinar 2 points higher? What does that look like? Are there some strategies today that you can take and help start moving towards that higher number? Whether that's to improve your screening, use technology, use some of the MI strategies. Hopefully you'll take a few minutes to write that down, put it on your computer, put it on a sticky note, have it somewhere so that you don't forget. If you want to dig in deeper, we have motivational interviewing training courses that are all online. We also have courses that will provide workshops for you, whether that's virtually or live in person. The online course is a standalone course and can be included with the workshop. It includes 8 continuing education credits. If you're interested in any of these pieces, definitely reach out. You can see my contact information here, our website, Leah is putting some information into chat. If you want to look at some of the information sheets and or the web links, she's going to put that into the chat. So I apologize. We went over about 5 minutes because we started about 2 minutes late. And if you have questions, I'm happy to stay on a little bit longer, answer those questions. If you want to use the chat or the Q&A, either one, I'm happy to do that. So thank you for your participation, and I hope that you are taking something away. And even if, you know, at this point you're like, okay, I'm not sure, I'm ready to move forward, send me a shout out on how you used a few of the strategies from this webinar. I'd love to hear, you know, how that went for you and what you thought. So if you have questions, put those into chat and I'll kind of hang around a little bit here. It looks like, how do you administer the surveys in clinic? So with the technology in the clinic, you can either provide a device for youth to complete the surveys. So you have like an iPad or some type of computer that they can complete the surveys. You can send them a link to their cell phone, to their email address, and they can complete it on their own device. Also, some clinics will use a paper version of RAPS, depending on how technology savvy the setting is. You can also send links through student portals and EHR portals. Yep.
Hey, Jen, we have one question in the Q&A.
Okay. Have you been able to figure out bidirectional data with integrating answers into the EHR? Yes. So we are able to provide integration in different ways. So it can be a single sign-on, it can be a PDF of what I showed as kind of that report that populates, that provides all of the information that you might need, like tallies and the brief interventions, can be pushed automatically as a PDF into an EHR. Also discrete data. So if you have the RAPS tool built as a form in your EHR, then they complete it in our system and those responses just populate into the EHR. So there's different ways that we can do integration. So you can reach out to me if you have more questions around that. All right. Oh, Randy shared, he reviews motivational interviewing before meeting with students almost daily. That's a great habit to have, especially if you're reviewing kind of what are some of those starters that I might want to try. Let me think about different ways that I might provide affirmations or reflections. And as you're using it more, the more comfortable you'll feel. And then I really suggest that you dig in and find whether that's training we offer or others are offering to really hone in and spend time on those foundational strategies, as well as some more that kind of build on top of that. All right, great. Well, thank you, everyone. Any other questions, please reach out, and hopefully you are going to walk away and start using some new strategies.